right. Well, I think most people that are here are connected, and so we'll go ahead and get started. Welcome everyone to today's webinar titled Health Center Leadership's Role in Team Building and Stress Management for a Resilient Workforce. Hi everybody, I'm Suzanne Spear. I'm the Senior Director of Workforce Development here at ACU, and I will be your moderator for today's session. So for those of you who are new to ACU or have never heard of us, we are the Association of Clinicians for the Underserved. We were founded 25 years ago by alumni of the National Health Service Corps. And while we have changed a lot over those 25 years, our mission remains the same. And that is access to care for underserved populations and really supporting the clinicians who serve those populations. And the key to doing that is really, the recruitment and retention of a clinical workforce. We have several programs that you can check out all about and read about on our website at clinicians.org. And we are here today. This webinar is brought to you by our STAR Center, which stands for Solutions, Training, and Assistance for Recruitment and Retention. So the STAR Center is our National Training and Technical Assistance Partner cooperative agreement that is funded through the Bureau of Primary Health Care. We've been doing this for about 8 years, and we are really your one-stop shop for all things clinical recruitment and retention. You can check out all of our free resources at chcworkforce.org, and everything that you see there, again, is at no charge to you, and we're always happy to answer any questions about anything that's on our website there. So just a few housekeeping items before we get into our content today. So we are recording this webinar, as you saw when you joined through Zoom. We will share this recording via email, and it will also be archived on our website. Feel free to use the chat box to ask questions, share comments and thoughts as we go along. We always welcome that. And we'll make sure that we answer all those when they come in. If you're having any technical difficulties, please send a message to Mariah Blake. You can do that either through the chat feature or through email, which is mblake@clinicians.org. And please complete the evaluation at the end. We'd love to hear what we're doing well, what we can improve on, and also Vivek always likes to know that we are making sure that we are evaluating our presentations for you. All right, so as we sort of dive into the content here today. So you all are here to hear and talk about workforce, and that's what we do here at the STAR Center. Well, the workforce is really what drives and fuels the health center mission. It enables you, your workforce enables you to fulfill your mission, which is to care for patients. Every health center looks a little different and does things a little bit differently, but each health center has that really the common theme, which is the fuel for your operations. And every health center has what we call these core components that make up their workforce landscape. Each one of these 8 different categories is really something that we work hard on here at the STAR Center. And today we're going to be focusing on 2 of our core components. Positive culture focused on engagement, and also tested recruitment and retention strategies here. So with that in mind, these are not siloed. They definitely come into each other, but we always like to start with these sort of grounding core components as we do all of our work here at the STAR Center. All right, and so as I mentioned today, I'm just your facilitator. I'm not your presenter. We have some amazing, amazing presenters. You guys are in for an absolute treat. So our friend Matt Bennett, who is the president of Optimal Innovation Group, and April Lewis, who is the CEO and founder of A. Lewis Academy, are going to be speaking with you today, and just really excited for them to introduce themselves further when it's their turn, as well as just present their amazing content. All right, so before I hand it over to Matt, I'm going to go over our learning objectives today. So first, we're going to identify the impact that stress and trauma in the workplace and create ways to minimize those stressors. We're also going to identify methods for resiliency at the organizational level. And then finally, we'll develop a plan to respond and recover from high levels of workplace stress. All right, and so with that, I'm going to turn it over to Matt, and I'm going to hand him the baton, and then he will go ahead and be able to get started there. So Matt, you have remote control.
I
take it away.
There. All right, thank you, my friend, and thanks for having me back. We've been through so much the last 2 years plus, but my growing friendship and respect for ACU and the great work you all do is one of the positives I'm taking out of this crazy stretch. So I just got my approval for a workshop for the conference. So that was a great hit of dopamine before coming on today. So my name is Matt Bennett, coming from Denver, Colorado today, and I'm not going to spend much time on myself because I think April would agree with me. This would have been much easier to be a 2-day training than a 60-minute training. So what I want you to know about me is I have a mixed background, and you'll see a little bit of both today. I started my career out as a therapist, and part of my work early on in my therapeutic practice with families and children was finding the adverse childhood experience study and really starting to realize the impact trauma was having on the youth, the family that I was serving. As I shifted my work into public health, HIV, healthcare for the homeless, underserved, federally qualified health centers, you know, that real foundation and understanding of the impact on trauma on those we serve has just been a guiding principle and really gave me a research-based base for the work that I did. Along the way, I got promoted into leadership positions, and unlike most sane people, who would read a book to learn how to do that, I went and got back MBA in healthcare administration. And one of the things that I thought I could contribute to the trauma-informed movement was I really saw the importance very early on the health of the workforce. This was way before COVID hit and the challenges of the last couple of years. We knew that folks in healthcare, folks in social services, folks in education, folks in law enforcement were basically the most burned out people in our societies. It would be hard to find a more burned out place than your locally federally qualified health center or emergency room at your social safety net hospital because of the impact of the work that we've done. So I really saw that, hey, I had this growing expertise in leadership and business, as well as this ongoing journey to understand the impact of trauma. So I want to share a little bit of how I think about really, as we talk about this engagement, and really with the goal of getting positive outcomes for our patients, but also organizationally as well. I just want to acknowledge as we get started off, obviously we've been through an unprecedented time of stress and trauma. You know, COVID is the thing we're still working to get through, but I'd be remiss if I didn't also say that there's been the biggest civil rights movement of my lifetime. Black Lives Matter. We saw violence against Asian Americans. I am appalled right now, and I will keep off this soapbox because it would go on way too long, with some of the legislative laws being passed against transgender people, LGBTQ plus communities. I'm really worried what I'm seeing nationally right now. So we've been through this tremendous experience. Our politics have been crazier than I've ever seen them in my lifetime. I have not seen a challenge to leadership like we've seen the last 2+ years. So I want to, in my piece, and I got a peek into April's slides, and I know she's going to support this as well, is thinking about this as a recovery. How do we help our workforce recovery? I think April's going to push us a little bit, but I want to kind of focus on that recovery piece, allow her to give some of these concrete strategies that I'm excited to sit back and learn from her with you all. So, oh, there we go. So one of the things that I did when I saw the COVID started to hit, so back in the spring of 2020, I got a gift given to me, and it was a painful gift to experience, but it was so needed, is working with nurses from New York. Why I say that that was a gift is because I saw what COVID was doing to these amazing people who are showing up every day, putting their own lives, the health of their families on the line to serve their community. So as I saw this tremendous trauma hitting professions that honestly, we weren't doing great before this hit us. When you look at the most burned out occupations, usually physicians, nurses, healthcare providers are usually in the top 5 somewhere, depending on the study. I saw what was going on with these individuals I was working with. So I took it upon myself to go a place I try to avoid whenever possible, which is peer-reviewed journals, really looking for some models that would help me at this point of our journey. How do we start to look at recovery while still maximizing the outcome for our patients? And the thing that popped up to the surface really quickly was this job demands and resource model. Been around for 20 years, it's evolved over time, but there was just a tremendous amount of research talking about how we do as leaders in organizations, our responsibility to help mitigate and help folks recover from stress and trauma of the work, and that connection to positive outcomes. So when we jump into the job demands and resource model, and I'm going to just share some pieces of it with you with the short time that I have with y'all today, we start out with what they call job demands. Now, this is the physical, social, economic, organizational aspects of a job that require sustained efforts and are associated with physiological and psychological costs. Now, you might just say, well, isn't that stress? And to a point, absolutely yes. I just want to point out, though, not all stress is bad. We call good stress eustress. And what the research on stress challenges us to look at is it's really the individual's perception of whether the stress is good or bad that determines whether it has a negative or impact on us or becomes a source of motivation. So job demands can, again, be very positive, but it also can lead to burnout as well. Now, when we think about what our workforce has faced over the last, I'm just going to use 2+ years from sort of the start of COVID, I have to put up there, even though it's not necessarily associated with work, the personal stress and trauma people have been through. And it may not be related to any of the traumas, the stressors that I mentioned leading up to this conversation, but just what life has been for folks, even just outside work. Now, the interesting thing for me, thinking about this from a totally academic perspective, is when you look at COVID, when you look at the civil rights movement, Black Lives Matter, and sort of the adjoining Me Too, all these things that have sort of really hit us, and you look at our politics, those transcend the work, personal, professional divide. So much of our politics enters the workplace. I know, working with federally qualified health centers across the country, I've heard dozens of physical altercations or things close to them because we ask somebody to put on a mask before they enter a freaking health clinic, right? And that has led to near physical altercations with folks. We also, I know a lot of folks can't talk to family members because of what's gone on politically, social justice in our communities. So I just want to put that out there. The other thing, and I like to use the umbrella of helping fatigue to describe these phenomena, is really just the intensity has increased around these things that have always been present in healthcare. One is just the amount of work that we have to do. For most of us, that has increased pretty dramatically over the last few months. Obviously, if you're in public health, if you're in healthcare, a pandemic's going to challenge us. It's going to challenge us to step up to that challenge. And for a lot of us, that's working longer, working harder than pre-pandemic. Empathetic intensity. This is the thing that really hit me when I started to learn about trauma, this idea of vicarious, secondary trauma, compassion fatigue. In other words, we know that emotions are contagious. And as folks in our community who seek us out for services are experiencing more fear, more trauma, more stress in their life, that our workforce is being exposed to that increased level of stress and trauma as well. Knowing who you work with, maybe folks experiencing homelessness, folks experiencing severe mental health issues, folks experiencing addiction. We were already confronting a lot of people's trauma day to day already. Obviously, with this shared traumatic experience we have, that's increased dramatically as well. And then moral distress and injury, where I don't feel like I can deliver the quality of care, or maybe I'm asked just because of circumstances to provide care that's outside the quality that I want to provide. And again, whether that's having to go virtual and not seeing everybody in person, whether that's just not being able to spend as much time with people because of the increased need, these have really all hit us hard during this pandemic. Then I really want to talk about trauma. And I've cut and pasted this right from my trauma-informed care slides, because I really think this speaks to a lot of our experiences. Now, when we think about what distinguishes the stress from trauma, that is a very individualized experience, but it usually includes three variables. The idea of uncertainty, not being predict what's going to happen next. Am I going to get COVID? Are we going to be able to stay in person? I've got the Healthcare for the Homeless conference coming up in a couple weeks that I'm really excited about in Seattle. I believe I'm going to jump on an airplane. I think it's going to happen, but I wouldn't bet money on it. I just don't feel like I can predict what's going to happen 2 weeks from now, much less 4 weeks from now in this world. So there's been incredible uncertainty there. Importance. You are on this call because you care about your community. You care about people in your community. You've dedicated your life in many respects to serving those who have been underserved, who have been discriminated against in our community. And that importance pushes us to give our best every day. But the challenge of this is when we see people we care about and are important to us hurting, their hurt can become our hurt as well. And then the duration. And I just want to point out really quickly, chronic trauma. This again comes from my trauma research. Chronic trauma, which hits our nervous system, our mental health, our social health, in many ways, just like a traumatic event does, is living in a high stress environment in the immediate threat of a traumatic event occurring at any given time. Does that describe what your life has been for the last 2+ years? Now, I'm not going to say you've been traumatized by the last couple of years. That is an individual experience that you and a clinician could determine. But I just think when you look at living in a high stress environment and in the shadow of the threat of a traumatic event occurring at any given time, I really believe that describes the healthcare experience, again, in this recent stretch and challenges we've seen. So what the job demands and resources challenges us to do is that if the distress or the negative stress of the job hits to a certain level, we're going to experience the moral injury, secondary vicarious trauma, compassion fatigue, and burnout. And what it shows, and this should not be a surprise for anybody on this call, a burned out, a traumatized, a morally injured staff is not going to provide a high quality of services. And they're going to experience, we look at the impacts of burnout that can eventually lead to things like cancer, diabetes, stroke, early onset Alzheimer's, some really dramatic things if it's hindered. So what we want to really look at as leaders is how can we best manage this? Now, one of the things that I'm getting really concrete with you with the minutes that I have with you today is to reset expectations. We've asked folks, and we call this in the stress literature, homeostasis. And that means we create a balance between us and our environment. What the pandemic has done is knocked us out of homeostasis. We've had to deliver care in different ways. We've had to figure out personal protective, how to keep ourselves safe during the pandemic with PPE. How do we keep our families safe? So our world got flipped upside down almost overnight as you think back to March of 2020. This gives us an opportunity right now to really revisit what does the next foreseeable future look like? And we know that through research is that people don't really know what's expected from them from their supervisors. And the interesting thing is research also shows they don't ask for clarification. So really sitting down and saying, and there's a new normal or whatever we want to call it at this point, whatever doesn't trigger you as far as these sayings that have been overutilized is, hey, moving forward, what are these expectations with the job? What does the next month or 2 months look like? I believe it also gives us an opening to talk about self-care. Now, self-care is a term I'm using less and less. And I'm using less and less because I think the message too many people are getting, and staff are tired of this message: we're going to burn you out during the day. We expect you to go home on your personal time, heal from that, and come back healthy the next day. That's not a research-based work, and it's really in many ways unethical to look at employee health and resiliency that way. However, how somebody sleeps, diet, exercise, whether or not they may practice some mindfulness, other things will impact their productivity. So having these conversations, if you want to have a conversation about sleep hygiene, maybe giving away a sleep mask, for example, to help support that, those little things that we can do along the way. So the thing that I want you to take away with my part of you, if you remember one thing, one is we really need to revisit what's expected from folks of the job. The other thing here with the research, and this is the real challenge to us, is how do we position job resources to offset the distress inherent to the work? And healthcare, when you look at it statistically, has historically, I'm not saying you failed, healthcare as a system has failed to do this effectively. So our real challenge here, how do we position resources to offset the distress? Now, one of the other real concrete things I want to put on your radar is everyone needs a resiliency and wellness plan within the organization. Now, I want to talk about this from three different aspects. One is a proactive plan. And right now, I want to just put on your radar if you're hiring new people, because I know that that's a difficult thing right now. However, and I'm going to not talk about you specifically because I have no data on you specifically, but healthcare in general, what are we doing? We're bringing a new person who probably has some excitement of starting their job into a burned out workforce. And we know through a concept called emotional symmetry that person is going to mirror the emotional states of the group. So we've got to spend extra time and attention to make sure that person stays healthy. So I always like to think about a wellness plan for somebody that's in a good spot is proactive. What are you going to do and how can we support you to stay healthy? We want people to be healthy each and every day if possible. However, being in some of the most burned out professions, when you see some warning signs, whether that might be trouble sleeping, headaches, exhaustion, maybe anxiety, maybe struggling with compassion and empathy, which is really energy intensive, what is your reactive plan? So I always like to have that real concrete. What are you going to do to keep yourselves healthy? How can we support you in doing that? And then when you do start to see some of these warning signs, how do you get back into health and wellness? Now, here's the other thing I want to put on people's radar. What are folks' recovery plans? Because a lot of us have gone well beyond the small symptoms of burnout and are really struggling right now. And so I really am challenging leaders and individuals to say, what can you do over the next 9 to 12 months to really recover your health and wellness? And think about it long term, because for most of us, I'll be honest with you, I had a recovery summer last summer because I needed months to really regain Matt again. Now, I still worked. I didn't take the whole summer off, but I took as much vacation time as I could. I got my own butt into therapy. You know, I really worked on that. And it took months, but I can document now that I've maintained that health from that recovery process. So having these conversations about recovery. I'm going to skip that for right now and move to the engagement piece. I know April's going to talk about this in more detail, but one of the things when we talk about engagement, being really motivated by doing great work, being really invested in the organization and the services that you provide your community. Now, the thing I wanted to plant here, because really the inverse of burnout, secondary vicarious trauma, which pulls us out of engagement, is whether or not we're really connected to the work. The piece of research I wanted to give in my section here is whether or not staff feel like their leaders and organizations care about them is the #1 predictor of engagement. So that is going to be key moving forward, where wellness plans are going to come in. with the couple minutes I have left, because I consider April a new friend of mine. I want her to be an old friend. So I'm going to end right on time here. I want to plant 2 more seeds with y'all. One is time off. For the vast majority of people, it's always individualized. One of the best ways they're going to recover is getting time away from work. So really looking at this as a recovery time. Trying to get people, there's some great research that a week is good, 2 weeks is golden. And there's a lot of great research that folks that can take that 2 weeks off. And I know, especially if you're short staffed, that could be a challenge. That's why I want you to take out the calendar for the rest of the year and really start to schedule this strategically, is that 2-week period off is really going to result in increased productivity for another 12 months. This is a real investment, not only in recovery, but for long-term productivity and quality as well. I just got to put this in here though. We need to see paid time off as an investment. And when we look at it as an investment, we want to maximize the investment. Think about the Monday or the day people return from their vacation, because what I hear so much, I come back on Monday, I have to jump right into seeing patients, doing my job, and I got to catch up on 2 weeks of work I missed. In other words, we're going to burn you out by Tuesday in most situations. Can we give people a half day to catch back up, a day to catch back up? In other words, can we maximize our investment? I like to think about if you invest in the stock market and you really hit it big, which I never do, it'd be like taking that investment, going to the casino and putting it on red 38, right? You almost like lose your investment right away. So really maximizing that piece. The final thing that I got to put out there is therapy. A lot of us have been through trauma. And I'm looking at myself here. This is constantly on my self-care, my wellness plan for myself, is a lot of folks have been through so much. A lot of people's work could have risen to the level of trauma over the last 2+ years. So really, I'm imagining if you're on this call, you have an employee assistance program, really making sure everybody's aware of that. And I want to challenge you a little further. And I know this might be hard, but I feel like I got to do it. I also think it's a little unfair, especially if they've been really traumatized by the work or burned out by the work, to say, hey, we want you to commute 30 minutes, spend an hour in therapy, commute 30 minutes back, figure out childcare, because we care about your well-being. Could you provide therapy on site? Could you pay people to go to therapy? In other words, they're not clocking out, they're not taking personal time to do it. And your answer to that might be no, but I want you to think in that way. We've been through an unprecedented time. And what a crisis determinant needs is a crisis response, not going back to the normal response, which research showed us wasn't working very well before the pandemic. And with that, I'm going to sit back and learn with you all with April. So my friend, I'll let Suzanne flip us over here. But I want to thank everybody for your time and work. And I can't wait to learn from you, April.
April, you're muted. There we go.
That is so funny. All of my buttons are gone. So that is weird. That never happened before. Well, good afternoon, everyone. I think it's afternoon, depending on where you are, with early afternoon, possibly if you're on the West Coast. Matt, thank you so much. I did want to give you a moment. There was a question that popped up. So before I go in, there was an ask for resources. So if you wanted to chime in and share or put however you want to respond to that, I want to still let you answer.
Absolutely. I will, Suzanne, if it's okay, if I maybe forward to those to send to the group, would that work okay?
Absolutely. we'll make sure that it's out
and
with
just so you know, I'm happy to talk books. So I won't get started on my favorites because that's a 2-hour stretch of its own, but happy to send that your way.
Perfect. Thank you so much. Well, as Matt said, I'm now going to bring us on in. What I want to talk about is how to take all essentially of what Matt said. How do we be responsive to your team and take a strategic approach to team building and stress management? I was in the chat saying hello to some familiar names, some faces I know. The last 2 years, I have been on a virtual roadshow helping organizations, and specifically healthcare organizations, but education as well. And I've even been on the payer side of the house, helping you all as managers and leaders create the workplaces that actually take care of your people in spite of everything that's happening. So I have connected with so many community health centers and PCAs around the nation. So I completely understand what you're dealing with. Some of my conversations are very raw and candid about the pain and the stressors. And one of the common themes that I will say that I hear is the application. You know that your people are tired, and to use Matt's term, the health of your employee is important. And some have gone as far as creating chief wellness officers. There was an article that I read in Harvard Business Review. I forget the gentleman's name, but he represented, he was with CMS, and he was talking to hospitals, but I should say it's for healthcare providers across the board. He was saying essentially after 2020, you need to have a chief wellness officer so you can be responsive to the pains and the stressors that your team members are dealing with within your organization. And to Matt's point, the last 2 years have been a challenge on leadership. It's been a twofold challenge. One, because you are in the thick of it as well. You are dealing with the stress. You are not exempt from everything that came with the pandemic, the social issues, things that's happening in your personal life. And on top of that, you have to lead your team. You still have to serve as that visionary, as that voice, as that anchor saying, follow me, I am taking you where we need to go. And you're leading while you're figuring it out. So my intent today is to give you a practical approach to take your team building and your stress management solutions that ultimately will improve the health and well-being of your employee, to how can you make it part of your strategic objectives and your strategic goals. I think there is a little bit of a delay when I advance forward. Let's see. Well, okay. So with that, my name's April Lewis. My specialty is people development and workforce excellence. I genuinely enjoy people. I enjoy talking to people. I love working with this group at ACU and the STAR² Center so far, and I will continue. Matt, you are my friend. Enjoy working with Matt. We have something good to announce to you all that we're doing together at the end of this presentation. But I really have a heart for people. For me personally, I look at it as we're all that we have. The animals are absolutely here to make it better, but I just have a heart for people. I can communicate with you. I can connect with you. Together, we make the world a better place. So from what I've done since leaving high school, serving in the Army for 6 years, going to war, coming back, going to school, working in healthcare, it's all been with people. And I take ownership of supporting people and helping them excel in their respective roles. I do have a 10+ year background working with community health centers. I have, bless you, Andrea, thank you. I have worked with community health centers. I've worked at a PCA. I've worked at the IPA where we contracted with the payer. And then when I ended my corporate journey, I ended at NAC. So I've seen it from all angles. And I'm now serving as interim COO, supporting a health center that recently lost their COO and going through a transition. I'm a certified executive coach. The predominance of my clients are C-suite leaders, a lot of CEOs. So I hear it firsthand, the pain and how do I do this? I want my people to feel a certain type of way. I want to take care of my people, but I'm tired. I don't know what to do. And to Matt's point, self-care, I have been a personal trainer and I'm also a health coach. I never really used the term self-care a lot. Then I started using it in the last 2 years because it connected people to what I say, whatever it takes to take care of you. And I agree with Matt. It's not, oh, we're going to just run you through the ringer all day, then go home and meditate and eat some yogurt and, get some fresh air. That's unrealistic and it's unfair and also unethical. So however you need to care for yourself, whatever language works best for you. Certified DISC facilitator. My motivation to doing that was to better understand the different personality types. DISC is one of many, but I think it's the most simple model to understand how people communicate and operate. So you, ourselves, can calibrate accordingly to get the job done. Neurolinguistic programming, that's just a simple way of communicating, starting with mastering your own communication and helping others receive your message the way that it's intended. So that is who I am and what I do. And I'd love for you to connect with me. My website is aprilLewis.com. Every Monday morning, well, I missed a few weeks. My mom had brain surgery. She is recovering nicely. I send out a new week note, and it's a general note to help you just deal with whatever life and business may bring. So I invite you to subscribe to that so you can just get a drip of something positive before you start your day. I will tell you, by the time you get it, you'll probably already have seen patients, dealt with fires and all that good stuff, but it'll be in your inbox waiting on you for sure. So going back to the question on the table, how can you as managers and leaders take a more strategic approach to team building and stress management? Well, I would love for you in the chat, if each one of you here could just drop the number of how many people you manage, that will help me conceptualize the size of your teams out in the field. So just put the number of how many people you manage at this current moment. So thinking about a strategy, strategy is the word 3047. Okay, I just want to see some of you got a big team, Jennifer. Strategy is a word that we hear often. And as I prepared this slide deck, I immediately thought about the upcoming workforce symposium that ACU is hosting in Nashville. That the theme is going beyond the buzzwords. And I chuckled and grinned when I saw that because yes, like self-care, buzzwords, they come, we say it all the time, but what do they really mean? It is easy to sit in a meeting and say, we need a strategy for improving employee well-being. Great. What does that mean? What is a strategy? So a strategy is a plan of action or a policy to achieve an overall aim. So your strategy is how you're going to do something to get to what you desire to do. So your aim is, in this context, creating an engaged and more resilient team, which means you need a plan to do so. So that's essentially saying, what steps will we take to achieve this aim? And I want to highlight this because it's more than just saying we need to do something. We want to do something. I'm going to join a webinar. We know it needs to happen. Wonderful. How are we going to get it done? What's going to be the check and balance system? So that is taking a strategic approach at anything. This is a strategy for your team, but you do it when you do PDSAs, when you have something, a new initiative come down the pipeline, you figure out how are we going to get it done? And then how are we going to hold each other accountable? So when you think about that engaged and resilient team and taking it from a very strategic standpoint, so it is part of your priorities. You look at it with the same level of respect and attention needed as you do your finances. Your wellness plan should carry the same amount of weight as your balance sheet, because without a well workforce, the balance sheet will be impacted negatively because they won't be there to do the work, to see the patients, to file the billing, the bills and the claims. So when you think about your respective team, and I saw the numbers 2, 4, 10, 16, 47, you all are leading different sizes, but what I hope for you to take for this website, from this webinar and sit back with your team is, how can we make this work? How can we be so intentional and committed that this is woven in the DNA of our organization? Well, first and foremost, what does it look like for your organization? What you need looks differently from each organization to the next. We say it all the time. When you've seen one FQHC, you've seen one FQHC. The needs that were happening in New York last year when Matt went, they were different from other places. They are different now from what they were experiencing a year or 2 years ago. So you first have to start with that crystal clear vision. What does an engaged and a resilient team look like for you? The metaphor I use often is the GPS. When it comes to life, personal goals and professional goals, you first have to know where you're going. Just like your GPS, all your GPS needs is an address. It does not need to know the weather. It does not need to know what kind of car you drive. It does not need to know who else is on the road. It is saying, tell me where you need me to take you and I got you from there. That is what a strategy does for people. This is where we're going and I am going to work us through it. So start, as Stephen Covey said, great, with the end in mind. What is the vision that you hold for your team? How do you want them to show up? Do you want them to be present? Do you want them to have cameras on? Do you want them to, do you want them to take advantage of the wellness resources you have? Do you want them to take that paid time off? So is somebody going to be monitoring that? Start with your very, very clear vision and be specific around it. And then you also want to know, how will you measure your success? One of my questions that I ask my clients in the coaching capacity is, how will you know you made it? How will you know you're successful? Because if you say, oh, I have a goal, let's just say lose weight. Wonderful. What does that mean? How will you know that you were successful at losing weight? Which means we need to put a metric around it. There has to be a value. So will you use your retention percentage? How many people, from the moment you really recalibrate and say, we're going to get intentional about creating this engaged workforce, this more resilient workforce that's connected and working together with themselves and the organization to manage their stress, how will we know that we're hitting the mark? Are you going to use satisfaction surveys? Surveys are proven, tested. You can never go wrong until you go wrong by over surveying or not answering the right questions, or not providing feedback from what you gathered. So starting with, what is it that we want to achieve? How do we want to look? What's going to be our aim? And then how are we going to know that we hit it? How will we know that we are successful? If you think about the GPS, the minute you turn too quickly, when GPS said in 0.3 miles and you dashed off the interstate, it immediately starts saying rerouting. It's not panicking, it's not shutting down, it just starts to recalibrate. So when you set a KPI, key performance indicator for yourself, when you say this is how we're going to measure success, as you track it, then you can say, wait, we need to recalibrate. If you do employee satisfaction or employee engagement scores, surveys at the first part of the year, and you look back at them the second part of the year before you roll out a new phase, you have to look and see, where do we need to recalibrate? What is it that we were working towards that we didn't hit? So always be clear on what you want to measure, how you want to measure your success of keeping your team connected and being responsive to your wellness strategies. Next, what is going to be the reward for achieving success? This again can go for another 2-hour presentation on showing appreciation to your team, letting them know that you see them, that they have hit the mark, that they are doing great work, that they are appreciated, that they are a valued member of the team. What is going to be the reward for achieving success? If you work with HR and you have a retention percentage that you put in place and you all work collaboratively with the organization to keep people on your payroll, to keep people here in their assignment, then what's going to be the reward? We as humans, we love incentives. We love celebrating our successes, and professionals oftentimes need to be reminded to celebrate every win. Every small thing needs to be celebrated, because what it does, it continues to build up your intrinsic motivation to get things done. You can leap from that momentum saying, it was a hard day, it was a rough day, it was a rough year, but we hit these numbers. We met our goal, which also means you have to set realistic and attainable goals. So we know the SMART method. Use that as you're looking at your wellness plan and how to really make it strategic. So saying what the reward is going to be, and be transparent with your team. Let them know that you're rolling out these new initiatives to strengthen the team and help them manage their stress. And at the end of achieving these goals, this is what you're going to do for them. Let them get excited about it. Let them be part of the process as well. And then you go into the plan. So how are we going to do it? You determine what's that address that you put into your organization's GPS. Where is it that we want to go? We want our people to minimize absenteeism. We want to maintain a productivity balance of X. We want to minimize error and build whatever your respective organization is going to use as a metric. Now, the plan to implement it. First, you want to assess the current level of engagement. Where are they now? How are they feeling now? I've worked with organizations and they haven't surveyed in any capacity over the 2 years. Yes, it's been intense. Yes, you've been busy, but you can't manage what you don't measure. So we have to get an assessment of where we are, that baseline data. If there are any statisticians on the line or people who just love the numbers, you know that baseline data is critical, especially when it comes to changing human behavior and performance. You have to know where you're starting. So start with a clear picture. This is where we are. Then you want to analyze your findings and discuss the goals with the leadership. Sit around the executive table, the senior leadership table, and say, this is where we are. You have your vision on the board of where you want to get with, but first I am right here. You know, again, when you put the GPS in, it's the moment you put the address, it's going to find where you are. Okay, from here, I have to get you there. It doesn't ask you where you are. It doesn't say enter your current location. Thank goodness for technology and satellites, it picks up. But in your organization and dealing with people and people who are tired and people who don't know sometimes where they are being led to, and people who are dealing with stressors and trauma in their personal lives, they need to know where they are right now. And you assessing it and looking at it and saying, this is the current state of our environment right now. Then you give that feedback to the team, and you give it in a way that is hopeful, saying that this is where we are. Even if your scores are low, it's a starting point because you're coming together, you're assessing this data for the sake of moving forward and moving forward strategically to create that healthier work environment, thus creating healthier employees. So look at the data and then report the data out. And the reason I say discuss it amongst the leadership is so the consistent message is going out across the team. We've all been in organizations to where there's a breakdown from the top to everybody else. You know, it seemed like that something was said, initiative or a change was rolled out, and it made perfect sense at the top. But then by the time it made it to mid-level management and on down, it was a completely different message, like the telephone game we used to play. So make sure your leadership team, your key leaders are singing the same song, are in tune as best that they can, and then deliver that clear, concise, and direct message out to your team. The next part of creating your plan is create specific action items to align with the goals. The key word here is specific. We want people to fully know where we're taking them. So when you create a plan, we don't want to use ambiguous language that can easily be pushed under the rug or changed from one location to the next, but creating those specific action items. What are you going to specifically do to help your team be healthier? When you construct that wellness plan to help them respond to the stress and the trauma that they're dealing with day in and day out, what is going to be the specific things that you do? There is so much power and liberation in specificity. It may take some work to drill it down, but the clearer you are, the easier you can get to that location, so you can get to where you're trying to be. Being specific is a stress management hack in and of itself. If you know what you're working towards, if you know where you're going, it helps minimize the distractions, because you are laser focused on the plan that you have set. So if something else comes up, you can say, okay, does this fit into where I'm going, or do I need to put it in the parking lot? Do I need to come back to this? Just because it's a great idea doesn't mean it's a great idea that needs to be dealt with right now, because you're working this plan. I have a note at the top of my calendar that I oftentimes write, and I use my phone. Yes, I'm techie, but then I also still write in a planner. And I say, write the plan, work the plan, because it's really that simple. And when you sit down and you have that very intentional, mindful moment and say, this is what I'm going to do, then do that. And it helps you stay single focus on what you're working towards. So if you come together and you pull your leaders together and you say, you know what we're going to start doing is creating a room that people can go in and exhale for a second. We're going to implement those 2 weeks of PTO if we haven't already, that Matt recommended. We're going to provide these resources. Can we create a little library of books, or, you know, share out links of ebooks, whatever your plan is going to be to help your team manage their stress. Be as specific as possible on what you're going to do. And when it comes to those action items, they can be things like creating outlets for team members to discuss workplace stressors. You know, Matt talking about therapy, I am a huge advocate of therapy. The tragedy that I experienced in 2006, which completely took my mind away, and I had to learn how to reconstruct your adult life mentally, physically, and spiritually, that brought me into therapy. And so I am a huge advocate for therapy, and that therapy can be whatever you may need it, licensed therapist, counselor, some people go there, spiritual advisors, but there is power in just speaking it out, getting it out of your head and just out so you can process it. So wherever the outlet is, whatever the outlet's going to be for your organization, make it a very specific action item. Are you going to take surveys? I'm a strong believer in not over surveying people, but we also need to hear back. We need to hear back. So can you do a comment box, a little suggestion box that people can put something in the break room? Can you set up a generic text account where they can send a text message from a de-identified number? There are so many things that you can do. Can you hold town halls meetings? And when it comes to opening the door, opening the floodgates to hear back from your team, be courageous about it. It is not to take anything personally. It is not for you as the manager and leader to all of a sudden feel like you aren't hitting the mark. No, it is purely to receive data. If you look at how your staff are feeling, what's causing them pain and distress, look at it as data and not a personal attack. And with that data, you can analyze it and you can synthesize it and you can do something with it to improve upon it. Because your staff, whether they say it or not, they know that you too are stressed and you're trying to lead them out of it. So creating that space is a very specific action item that you can do to create that more resilient and engaged team. Updating your policies and procedures for consistency. Again, if you have a team that oftentimes switch locations, they go from site A to site B or site D if they need to cover down, and each location operates differently, that's stressful in and of itself. There should be some uniformity. When you look on the clinical side, they have their standing orders, setting up your templates in your EHR, if this, then this. That helps remove the stress of figuring it out, making it make sense. So when you look at your policies and procedure, which I'm sure you read just for fun often, and when you look at them, are you implementing that consistency across the board? I look at organizations as a machine, and we want to be a well-oiled machine, an operating machine. I don't know anything about cars. I know to call 1-800 somebody, pick me up if there is a car issue. But when I think about an engine has all these different pieces that make the car go. Everything has a point. And if you were to take it apart, the key thing is putting it back in the right place so the car can move and move safely. Look at your organization in the same way. Your organization is the name of it. And then you have these different locations. But just because they're different locations does not mean that they shouldn't operate within the well-oiled machine. Yes, there will be differences based on the needs, the location, the resources, whatever the case may be, but there should be some consistency so your team feel as if they're moving within one machine and not multiple machines. Another easy stress management hack. Another action item that you can adopt is creating wellness ambassadors or whatever you may call it, but who's checking in on the team from within? As leaders and managers, and I love the language that Matt used, the last 2 years have been a challenge to leadership. So you have all these things to take care of, getting through the day-to-day operation, payroll, leading, vision, strategy, all of these things. But from within, how can you leverage those champions that's on your team? There is always somebody that's shining bright, raising their hand to help, who's leading from within. Can you grab those people and say, I want you to help me help your colleagues? So check in from within. It can be as formal and informal as you desire. Let that be part of your strategy. But your team members are already talking to each other. Why not infuse some of that conversation with some helpful wellness tips or getting some feedback as to how they're all feeling about current changes, patient volumes and things of that nature. So these are a few very specific action items that you can do as it relates to creating the strategy. And the last three I want to share with you is leveraging technology to minimize repeat and duplicatable processes. Technology is our friend, of course, when it works, not like when all your Zoom links disappear, but using technology, if you find yourself doing the same thing over and over, responding to the same things over and over, processes happening all the time, how can you systematize it? I even shared with the CEO, why not create an internal FAQ? If you know people are constantly asking the same question, especially in something like the IT department, but if you know there's a subset of questions that are going to always come up, can you create an FAQ? Can you create a document, a generic email that's going to be used in response to the same questions? Having that idea for what's happening within your organization and what needs to happen, using technology to make it easier is absolutely your friend. We know about it in the EHR. We know setting up templates save time. You know, we minimize death by 1,000 clicks, but in other ways too, with other processes that happen, leverage technology. We're on a computer, we're on a phone. How can we make our lives easier? Even with Matt, we're working on another project that we'll share at the end. I think, hey, can we put this in a shared drive so we could just type in together using technology? So offering ongoing skill set and mindset training. Your training portfolio should be representative of the person that you aspire your team members to be. Your training portfolio should be representative of the person you aspire your team members to be. That means, to use some very old terms, there should be a healthy balance of hard skill training and soft skill training. This is one that will fit across over both lines, I would say, but even just putting the focus on recognizing that they are dealing with stress, recognizing that they are recovering from traumatic events. Infuse that into your training program as well. We want them to do their job and do it well, but rarely do people call on me and some of my colleagues like, oh, my people aren't doing their job. It's often, I need help for my people to get through. Right? So making sure your training portfolio is representative of that ideal team member, and then monitoring and measure your workflows and processes regularly, and thinking lean. Your strategy is, you want to be strategic, right? Creating a plan that's responsive to where you're trying to go, and cut out unnecessary steps and bottlenecks and fluff and busy work and things that take away from the core mission. You know, the quickest way to get from A to B is what you want. That's what lean is, which means you may need to stop doing task inventory. What all are we working on? Every department, every team, just dump it all out. What do we have responsibility over? And then what can we let go? What can we push off? What can we systematize? How can we make this easier so we can be efficient and breathe more throughout the day? So these are some examples of some action items to create that strategy for your team. So remember, it's your people, it's your processes to get to the outcomes. Know what that outcome is. What is it that you want to produce? And then reverse engineer back from that. So in closing, the essence of all of what Matt and I are saying is really communicating with yourself about being open and honest about what your team members are dealing with, and then communicating it to your team how you're here to help. It's not just on them to go home and burn an incense, light a candle, and figure it out. It is on you as an organization to help them to create that environment where everyone can work well. So as you set that vision, clarify it and communicate, make sure it's crystal clear. Open up the door for questions and feedback. When you assess the situation, gather and present objective data. What's happening? What's the current state of our organization? We're going to use this to drive us to where we want to go. And then taking that action, create and present a responsive action plan to support and engage your resilient team. So presenting what you're going to do. If you come together and say, this is the vision, this is where we're going to go. I understand we're here, but these are the action steps to create this healthier organization. We're going to do it together. Presenting to them, showing them what those steps are going to look like so you can get that full buy-in from the team. So with that, I do want to make a note. Coming soon, fall 2022, later this year, Matt and I are teaming up to create a really rich organizational and leadership resiliency toolkit. This was a very micro dose of what you're going to get in that toolkit. And the STAR² Center and ACU will be pushing out a lot more information about it in the months to come. But I will tell you, we had a conversation, and what we said is what we're speaking to this point here. It's not just about the staff providing self-care. It is about the organization constructing an environment that promotes and fosters and encourages healthy employees, and that you're going to have a plethora of resources inside that toolkit. So thank you all so much for your attention. Suzanne, I will hand it back to you. And if there are any questions in the chat, please let us know.
Awesome. Thank you so much. And we are absolutely just thrilled to be, obviously, have you all today, and so grateful for your for all of your knowledge sharing that you all have done today, and thrilled that you all are continuing to do work with us in this area. And as April shared, she and Matt will be working with us to develop that organizational leadership resiliency toolkit. So stay tuned for more information on that. It looks like we have a couple, whoops, that's what I get for clicking
You're
around.
back in
Sorry,
control.
you guys. Yes, it is. Like mission control just went crazy. It looks like we have answered all of our questions, so we're good. We don't have any questions yet. And so with that, we have about 30 seconds left, and I will let Mariah open our evaluations. And so if you all would please fill out your evaluations, we would really appreciate it. I know so would April and Matt. We thank you for your time today. Thank you again to April and Matt for sharing all of their knowledge with, or maybe not all of their knowledge, but just a bit of it with you today. And we hope you guys have a wonderful day, and we look forward to seeing you all on a training soon. Take care, everyone.
Thank you, everybody.
Thank you. Bye.